Now coming to the deep group of the extensor compartment of forearm, there are 5 muscles in the deep group. The deep muscles of the back of forearm, they do not cross elbow joint. All of them arise from radius and ulna and interosseous membrane, and all of them are supplied by posterior interosseous nerve running between the superficial and deep group of muscles. So here posterior interosseous nerve, posterior branch of radial nerve runs between the superficial group and deep group in a plane between these two group of muscles. So 5 deep muscles are supinator, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indices. So if you take out these superficial muscles here, especially extensor digitorum and extensor carpi ulnaris and this extensor digiti minimi, here we will see the deep muscles. So here you can see the deep muscle here. So you can see the posterior interosseous nerve above it. I told you it runs between the plane of the superficial deep group. Here you are seeing supinator muscle. It takes origin from the lateral epicondyle, lateral ligament of elbow joint, and also some part of annular ligament and supinator crest of ulna from the triangular area in front of it, and it inserts into the upper 1/3 of the posterior lateral and anterior surface of radius. As the name suggests, it helps in supination of the forearm at superior and inferior radial ulnar joint. You can see here, this is the origin. It comes from lateral epicondyle, the supinator crest. You can see here, lateral epicondyle, supinator crest, part of this lateral ligament and annular ligament. It takes origin and it runs laterally and downwards, inserts into the area lateral side of the shaft of the radius above this anterior oblique line. This is the anterior oblique line. So it inserts into a triangular area above it. You can see the origin here, the lateral epicondyle and also supinator crest, and this is the insertion over the radius above anterior oblique line. You can see the action of supinator here. It helps in the supination of the forearm at superior and inferior radial ulnar joint. You can see here, it helps in the supination from prone position, and even you can see here the tendon of bicep brachii is also a supinator. So this is the supinator muscle, and you can see an arc here. This arc, that is the arcade of Frost, through which the radial nerve enter the forearm. I also emphasized while telling the flexor compartment of forearm that all the major nerve enter the forearm between two heads. Median nerve between the two heads of pronator teres, ulnar nerve between two heads of flexor carpi ulnaris, and radial nerve between the two heads of this supinator. And this region is called as arcade of Frost. And the deep branch of the radial nerve here, it lies over this muscle and supply all the majority of the posterior compartment muscles. You can see here, supinator supplied by posterior interosseous nerve. As you can see here, the deep branch of radial nerve is entering between the two heads of supinator and entering the forearm. And as I already told you, this posterior interosseous nerve lies between the plane between the superficial group and the deep group of muscles. After the supinator, we are going to the other 3 deep muscles here, that you can see: abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor pollicis brevis here. These abductor pollicis brevis, abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus, these are called as crop out muscles because these emerge from the furrow in the lateral part of forearm between lateral and posterior groups of the superficial extensor muscles. These 3 muscles gain insertion on the 3 short long bones of the thumb. These 3 muscles are called as crop out muscles because they go in a furrow here. They cross the tendons of this extensor muscles here carpi radialis longus and carpi radialis brevis, and insert into thumb. These three deep muscles are related to thumb. Abductor pollicis longus, extensor pollicis longus, and extensor pollicis brevis here. Abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus from lateral to medial side. These are cropot muscles. If you see the abductor pollicis longus, it takes origin from both posterior surface of radius and ulna and also the interosseous membrane, and it inserts, you can see this origin, and it inserts into the base of the lateral side of the base of the first metacarpal. Even though it is longus, it has very short course, and as the name suggests, it helps in the abduction of the thumb at first. You can see the origin here. It comes from the origin, that is, it takes from origin from the posterior surface of the ulna and radius. It runs downwards and laterally inserts into the base of the first metacarpal, that is a thumb. You can see, as the name suggests, it helps in the abduction of the thumb. This is the abductor pollicis longus along with abductor pollicis brevis. It helps in the abduction of the thumb. I told you already during the thenar muscle discussion, the plane of the movement of the thumb is at right angle to the plane of other four fingers. This is the action. So abductor pollicis longus being the extensor muscle, it also helps in the extension of the hand at wrist joint. Now you can see it also helps in the extension of this thumb here. It also helps in the extension along with the extensor pollicis longus and extensor pollicis brevis. Now from lateral to medial, we have discussed abductor pollicis longus. Now coming to extensor pollicis brevis here, this muscle, you can see it takes origin only from the posterior surface of the radius. You can remember brevis, B-R-E-V-I-S, R is there, it takes origin from the radius, that is lower 1/4 of the posterior surface of the shaft of the radius. You can see this is the origin, and inserts into the base of the proximal phalanx on the dorsal surface. You can see extensor pollicis brevis, it is supplied by posterior interosseous nerve. So its action is extends the thumb at metacarpophalangeal joint and also at carpometacarpal joint, first carpometacarpal joint. You can see here the origin of extensor pollicis brevis and insertion onto the proximal phalanx of the thumb on dorsal surface. You can see here the extensor pollicis brevis is acting on the thumb and causing the extension of the thumb at the proximal, that is metacarpophalangeal joint and also first carpometacarpal joint. And you can see now the lateral muscle in this cropot muscle, this medial most muscle. We have discussed abductor pollicis longus, extensor pollicis brevis, and now we are going to extensor pollicis longus. You can see it takes origin from the posterior surface of the ulna, brevis from the radius, and it goes and inserts into the base of the distal phalanx of the thumb on the dorsal surface. Extensor pollicis longus. You can see here it comes from the posterior surface of the ulna, shaft of the ulna, and inserts into the distal phalanx, being a longus tendon. So being this, so it helps in the extension of the thumb at the phalangeal joints, interphalangeal joints, and also carpometacarpal joints, metacarpophalangeal joints, and also helps in the extension of the hand at the wrist joint. Now coming to the last muscle of this deep group, that is Extensor Indices. It takes origin, you can see it takes origin from the posterior surface of the ulna. As the name suggests, it goes and inserts into the phalanges of the index finger. You can see the origin is from the posterior surface of the shaft of the ulna below abductor pollicis longus and the extensor carpi ulnaris origin. This is the extensor indices. It joins with the tendon, or it lies medial to the tendon of the extensor digitorum muscle for the index finger. Through extensor expansion, it inserts into the dorsum of the middle and distal phalanx of the index finger. It helps in the extension of the index finger and supplied by all these 5 deep muscles are supplied by posterior interosseous nerve. You can see the origin here from the ulna and insert into the base of both middle and distal phalanx of the index finger. You can see here how it helps in the extension of the interphalangeal joints of index finger. Extensor indices. Nerve supply is posterior interosseous nerve.